To bring up Paulette Garin, Wisconsin State Coordinator for Progressive Democrats of America.
Good evening. Before I go into the message I prepared for you this evening, I'd like to share a personal story with you in regards to health care. Today, as an only child with no siblings, no spouse, and no children to help me, I signed my father into hospice. My mother passed away about 2.5 years ago. And while this is a very difficult time for my father and myself, and I feel sort of blessed that we're in God's house tonight and ask all of you for a special prayer, I know that because my father has Medicare and an extraordinarily good supplement plan, that we will not have to worry about any of the bills and any of the costs in regards to his care at this time. If you're wondering why I'm here tonight after having to go through such a trying day, my father hurried the RN along who was doing his intake information and asked her to please expedite the process of filling out the voluminous number of forms that he had to fill out this afternoon, because his daughter needed to go to Milwaukee from Kenosha, where we live, and talk to people about health care reform. A girl can't have a better dad. Anyway, I am Paulette Garin, and tonight I speak on behalf of two organizations, Progressive Democrats of America, PDA, and Healthcare Now. Both organizations are members of the Leadership Conference for Guaranteed Health Care, the National Single Payer Alliance. The Alliance is a coalition of 22 million nationwide who support single-payer health care as the solution to America's health care crisis. There are two different flyers on the table by the door where you came in, and I would ask you to please take both a copy of each one as you're on your way out this evening. What is single payer? It is the gold standard of what we should ask for in regards to health care reform. It is 100% guaranteed coverage for all Americans, regardless of job transfer or pre-existing condition. Single payer fulfills President Obama's 3 principles of cost-effectiveness, access, and choice, unlike any other proposal. Single payer is inherently fiscally responsible. It will control the cost of health care for millions of Americans, especially the middle class, as well as state and local governments. Single payer removes the negative role played by private and for-profit health insurance companies. They're no longer in the equation. Single payer does not provide federal taxpayer subsidies to insurance companies because they're not in the equation anymore, and it rids seniors of the negative effects of Medicare Part D. No one is going to be fined, treated as a tax evader, or risk jail time for failing to buy health insurance under a single payer system. It is estimated that a single payer system would actually save $400 billion annually. Single payer guarantees access to health care for all Americans. Unlike any of the other proposals circulating through Congress, single payer is the only plan where losing your job does not mean losing your health care. Even President Obama's promise of keep what you have is flawed when your employer decides to change or drop your coverage. Single payer guarantees your choice of doctor and hospital, unlike those who get their insurance through an employer, and the choice remains with the insurance company. Single payer is the only plan that guarantees everybody in and nobody out. In addition to fulfilling the principles of cost, access, and choice, single payer is currently the only plan that will eliminate the shameful disparities in U.S. healthcare. The proposed expansion of Medicaid will not lessen disparities. I know from my own professional experience as a nonprofit executive that just because a patient has Medicaid does not guarantee that that person will find a healthcare provider willing to accept a low Medicaid reimbursement rate. Major Medicaid expansion will eventually prove unsustainable because it pushes costs back onto states that now suffer severe budget crises. Single payer is not socialized medicine like some try to scare us to believe. Single payer is publicly funded, but privately driven by you and your doctor. Single payer is, quite simply, expanded and improved Medicare for all. Have you heard of anyone wanting to give up their Medicare? Single payer eliminates the bureaucratic middlemen of the insurance industry that take 31% of every healthcare dollar. No insurance company CEO will decide who has medical coverage under a single payer plan. Healthcare reform in the form of single payer is the real economic stimulus package. The number one factor affecting an American company's ability to be competitive in the global economy is outrageous employee health insurance costs. If we do not get single-payer health care passed at the federal level, momentum continues to build nationwide to pass single-payer legislation within individual states. California's already passed it twice, but Arnold Schwarzenegger has not signed it into law. This is how Canada achieved a national health care system, one province at a time, starting in Saskatchewan. So please continue to encourage members of Wisconsin State Legislature to support single payer. On July 22, 2009, President Obama gave a press conference where he said, "I want to cover everybody. And unless you have a single payer system, you're probably not going to reach every single individual." So if this is what our president said, what stands in our way? A Congress bought and paid for by the campaign contributions of Big Pharma and the insurance industry. For those who support single payer, we believe that health care is a human right. We also recognize that health care reform is a multi-step process. Any real reform we have seen in this country, civil rights, women's suffrage, labor unions, occurred over a period of time. So what can you do right now? Call and write Senators Feingold and Cole and ask them to support Senator Bernie Sanders and Senate Bill 703. This is single-payer legislation that will hopefully come to the floor of the Senate and be debated. In addition, contact Wisconsin's entire congressional delegation, both senators and all 8 congresspersons, and ask them to support Representative Dennis Kucinich's amendment, which would allow individual states to pursue single-payer legislation. Healthcare reform truly is the civil rights movement of our time. Single-payer, the most humane, cost-effective, and comprehensive solution we have, is the gold standard. We are in the fight of our lives because our very lives depend on it. Thank you.